thanks for tuning in. You know, as host of Building Wisconsin, I'm usually on locations throughout our state, showcasing the hardworking men and women in the organized building trades. Today, however, I've been asked to showcase the healthcare system offered through Plumber 75, Steamfitter 601, and Local 118. Now, in light of the current COVID pandemic, we decided this video would be a great way to provide a virtual open house and tour of these modern healthcare facilities, and also introduce you to the healthcare providers that are here for you when your need arises. So let's get started with Angie Taylor, who will explain more about the CareATC partnership and why members should be excited about the services they provide. Well, Angie, when I learned we were shooting a video to enlighten the members on the healthcare offered through Plumber 75, Steamfitter 601, and Local 118, I was curious the locations we would be at. And I gotta tell you, this one here at Greenfield, it's really convenient to get to.
Convenience is a key aspect of the care that we're trying to provide to these members. We selected this location based on the zip codes of the Steamfitters group and compiled them to find a central location that would be most convenient for them.
Well, like I said, it really is convenient. And then did you also do that up at the Germantown Clinic?
Correct. And so the Germantown Clinic is unique in that now we've partnered with both groups to use both clinics, and so we went again and looked at zip codes to find another location that would be central to the members.
Okay, so as far as the ATC model, how does it differ from traditional medicine?
So we touched on convenience a little bit, and one of the really exciting things about CareATC is it's an opportunity to provide healthcare in a different way. In traditional healthcare, you call your provider and often have to wait a week or several weeks to get in.
Sure, if you're lucky, you can get in within a week.
Right. We see over 90% of our patients within 24 hours.
Wow, that is awesome.
So it's a huge aspect of it because your symptoms are going to vary from one day to the next. And so if you have to wait a week to see your doctor, that's going to change things. And so we want to get our patients in and seen as quickly as possible.
That is a huge advantage. I can see that right now.
The members can get on their mobile app, they can call our call center and make an appointment for that same day.
Wow, that is awesome. And convenience is a key, not only in location, but in the ability to get in quickly to see it, that's for sure.
Yeah.
So are these clinics in addition to other member benefits? You said this is a primary care, but do I have to give up my primary care doctor?
Absolutely not. We encourage you to use these clinics as your primary care provider, but if you have a doctor that you have a great relationship with and you'd like to continue that relationship, that is absolutely fine.
Okay, from a member standpoint, is there a cost to me? Is there any co-pays when I make an appointment and come in?
There's no cost to any member for anything.
And then what about for my family, and like if I have a wife and kids that want to come in?
Yeah, so if your wife and children are covered by your insurance plan, they absolutely can use either clinic. We don't see children under the age of 2, but anybody else is more than welcome to call and make an appointment.
And then as far as the CareATC model, are you looking at the group as a whole?
Absolutely. One of our focuses is on this population. So our doctors are able to really focus in on these members and their families. So we're looking at preventative medicine as well as what we call acute needs.
Okay, so if I'm understanding you correctly, you're saying the group as a whole. So the steam fitters, the plumbers as a group, they have specific needs, they have specific typical injuries or wear and tear on their bodies, and you guys develop, is it fair to say, like a program to help them stay healthy?
Absolutely. Plumbers and steam fitters are going to have more musculoskeletal injuries, knee problems, back problems, things like that. And so without having to focus on maybe the geriatric population or the very young, they can really spend a lot of time knowing the latest research and the best techniques to help with those injuries.
Well, it really makes sense to me. I mean, from a member standpoint, this preventative care specific to my industry needs, I'll say, will really help me keep working, enjoying a rewarding career in the pipe trades.
Our goal is to treat people, get them back to work, and if we can prevent some of the injuries that may prevent them from working, we're going to do that.
Dr. Isaacson, wonderful to be here at the Greenfield Clinic.
I'm glad you could come out.
Well, you know, as I look around, it is so warm and welcoming here compared to more traditional type clinics that I've been to.
Yeah, we try to make it as friendly and easy as possible for the patients to come in.
Sure, and talking to Angie up there, she mention that you've been with the CareATC Clinic here for 2 years.
Almost 3. Yeah.
What do you like best about it?
The patients, they're friendly and open to suggestions and do pay attention to their health. So I like all my patients, but patients here are exceptionally friendly, and we treat a variety of conditions, and a lot of it is based on maintaining their health. You find that the patients are losing weight and understanding health and diet and nutrition, and that's the goal. I mean, physicians theoretically are teachers.
So that's the wellness, when Angie was alluding to
Yes,
that it's a
right.
wellness program. Can you expound on that?
Nobody wants really to go to doctors. So the goal is to keep people healthy so they don't need to continuously see a provider. So weight control, and blood pressure control, and cholesterol control, and exercise and diet, and mental health, all these things factor in to the patient care.
Almost a new way of thinking. I mean, she said this doesn't necessarily take the place of a primary care clinic, but it's kind of a new way of thinking, this CareATC model.
Well, this can function as a primary care clinic. We do everything here that a primary care clinic would do.
Okay, so when you say a primary care clinic, if I cut myself, I need some stitches, or my back is sore, I can come in, I can schedule an appointment. And
Yes.
she said I can get in within 24 or 48 hours usually.
Oh yes, we've repaired lacerations here, whether it's an incision and drainage or, like you said, laceration repairs.
Sure.
And then the traditional practice, whether it's an upper respiratory infection, anything all the way to chest pain. So anything that you would go to a primary care physician for, we can treat here, and we can act as your primary care doctor.
And so do you also do like routine checkups, shots, say vaccinations, flu
Yes.
shots, things like that?
Yes, we have tetanus, pneumonia vaccines, shingles vaccine, and I usually try to make sure that people are up to date on their vaccinations and inform them of what they need.
Okay, so do you have access to my past medical records if you needed to look back on those, or if you needed to, say, coordinate something with a specialist, say I needed some specialized surgery?
Yeah, we have forms that the patients can fill out. I can't request them by law. They need to be signed off by the patient, but they just have to fill out a form, send it to the provider, and then we'll get the records and scan it into their chart, and I can look back over and coordinate their care going forward.
Okay, what happens if I come here, I have strep throat or something, I need a prescription, are you able to write prescriptions so I can go get them?
Yeah, we actually will fill the prescriptions right here. We have a pharmacy in the clinic that
Get out
has
of here, right here?
right here.
Is that included in the cost?
Yes, it is. And we have about 50 or 60 medications. We do point of care service. We can test for the flu, we can test for strep, we can test for urinary tract infections, and if it looks like a medication is needed, we'll dispense it from the clinic, assuming there's no allergies. And they can start right away without having to go to the pharmacy. And it's a full course of medication.
Well, just meeting you here, it's been awesome. I mean, it really helps break down barriers for me personally,
Yeah.
and for the members alike. You're very inviting.
Yeah.
I would encourage anybody to come out here, schedule an appointment, and you can get in within 24 or 48 hours.
Yes, and lastly, we spend a lot of time with the patients. The CareATC model is set up to not have a 12-minute visit and out the door. 45 minutes to an hour is not unusual many times, so we do get to know the patients and not only what I have in mind for them, but what they have in mind for themselves.
Well, Dr. Hill, I'm pleasantly surprised coming up here to the Germantown Clinic. This is beautiful. I knew it was brand spanking new, but this is conveniently located and very refreshing from a healthcare standpoint.
It's a beautiful building. The decorations are warm and welcoming. It's a very calm atmosphere. I love it here.
And that's key, I think, just personally speaking, when I go to the doctors, I don't want to be stressed out. I don't want to be in a sterile environment. This is very open, welcoming. And,
Absolutely.
you know, talking about your background, you're new to the CareATC whole model of care.
I am.
But you have lots of experience in traditional medicine. What led you to come to this facility?
Yeah, so I have had a lot of experience. I've practiced in a traditional practice for 22 years prior to coming here. And the opportunity to get to know people over a long time has been wonderful, and I hope to repeat that here. The difference and what drew me here is the ability to really spend time with patients, the ability to get to know people and not feel rushed to get to the next patient. So it's not as volume-based as a traditional practice is. It's really based on keeping people as healthy as possible.
That is awesome to hear. I know Dr. Isaacson down at the Greenfield Clinic was alluding to that as well, saying that he was most excited about the opportunity to develop these personal relationships, not only with the members, but with their families as well. Really helps break down barriers, because some people, let's face it, are apprehensive about coming into the doctor.
You know, I look forward to getting to know the whole family ideally, whether it's one of the men coming in or the women coming in or the kids coming in.
Well, I'm glad you brought up the spouses, and in my case, you know, my wife, my daughter, they definitely prefer to see a female doctor when they go to an appointment. If that situation arises in the pipe trade, someone can have their wife or their daughter call here and actually see you, correct?
Absolutely. You know, again, that's the beauty of the system here, is that they'll know who they're seeing. There's not a call in and whoever has availability will see you. They know they're going to come in and they're going to see me, which is really nice, I think, for the patients to be able to form that relationship.
And is it similar to the Greenfield Clinic, where if I call up, chances are I can get in that day or for sure sometime the second day?
Absolutely.
Now at this clinic, what are the services that you're going to be able to provide the members?
Sure, we will provide the full breadth of services to members. So they can come in and expect to have health maintenance addressed to keep them healthy, as well as any chronic diseases, diabetes, hypertension, heart disease, as well as any acute issues. So if you come in injured, we will take a look at you and see what you need. If you cut yourself, we're going to have you come in and see if we can stitch that up for you. So, or if you're feeling sick, you come on in and we'll help you understand what's going on and how to help you feel better.
Sounds like a full-service medical facility here.
It is.
Which is really nice, probably for you as well, having all the resources here at your disposal.
It is. It's very nice having everything in one area. And again, the concise team that we have that will take care of you, I think is very comforting. And our ability to get to know the patients and the patient's ability to get to know us as well.
No substitute for peace of mind, and a lot of peace of mind comes from the comfort you have of knowing someone, feeling like you're a friend with them,
Right.
versus just another face in the medical crowd.
Right, right.
Well, we're looking forward to the members utilizing this brand spanking new facility here, and they can take my word on it that this is really warm, welcoming, and top-notch medical professionals here to help. That's
Yeah,
great. Thanks for
excellent.
coming on.
Thank you.